Hello, everyone. This is Chadi Alraies, and this is coming to you with our first episode of SAMS Voices. I'm really privileged and happy to be the host for this series coming to you first of the month of every month going forward. The purpose of this podcast is to highlight SAMS members as well as Syrian physicians who have been doing phenomenal job academically as well as clinically, and also has been doing a great work in terms of helping refugees as well as people in need across the board. Today we're going to start with our member as well as board member, Dr. Sawsan Rashdan, who is associate professor at UT Southwestern and serving as a quality and health equity officer in hematology and oncology. She leads global oncology efforts and participates in medical mission of Syria. As a board member of Syrian American Medical Society, or we call it SAMS, she helps shape the healthcare in conflict zones. At UT Southwestern, she leads quality improvement project and refugee health education. Dr. Rashdan specializes in lung cancer research with several publication and clinical trials. I mean, if you look at her CV, it's a phenomenal work. She's also active in mentoring students and serves on multiple committees focusing on health equity and inclusion. Dr. Rashdan, thank you so much for being with us and thank you for your time early morning.
Thank you so much. It's really my pleasure to be with you today.
Rashdan, we're going to start with a quick question. Is just tell us a little bit about yourself and your education journey for the audience to know you.
Yeah, sure. So I was born in Damascus, Syria. I'm originally from Daraa, Syria. And I went into medical school in Damascus, Faculty School of Medicine, graduated in 2007. And then fulfilling the dream of my father, who always wanted his kids to always get the best of the best education in the world. I went to pursue training in the US after the medical school. So I also met my husband in medical school. So we coupled match in training in Indiana University. So that was in 2009. We started internal medicine training. And then after internal medicine, he did cardiology and I did hematology oncology. We finished in 2016 and then moved from Indiana to Dallas. I started working at UT Southwestern in the Division of Hematology and Oncology. Initially, I started seeing breast cancer patients. That was actually that was my goal and my dream, is to actually be a breast oncologist. But then I started seeing some lung cancer patients. And at that time, in 2016, lung cancer prognosis was very, very grim. And that was part of the reason why I didn't want to do a lung cancer. And actually, a lot of oncologists didn't want to do lung cancer because the treatment was really not very, people don't do well with the treatment. It was only chemotherapy. But then right then in 2016, when all new treatments for lung cancer, specifically immunotherapy, started being on the market, that changed the prognosis. So I actually, I saw some patients who did extremely well, and I felt like I was helping patients by giving them treatment. So I actually focused on lung cancer. Now I do only lung cancer. That's what I specialize in.
Well, this is a very, I mean, inspiring story to tell, and also definitely coming from Syria, very challenging as well, coming as international graduate, as we all know. So tell us, what inspired you to be in medical profession? What kept you going that you really, like, as you said, you took the mission and the vision of your father, you wanted to be a physician, you wanted to be an oncologist. So what is the spark in you that kept you going?
So I always, when I was like 5 or 6 years old, my father used to call me Dr. Sawsan. And I kept hearing that when I was a little kid, and that's all I wanted to do, is being a doctor. I didn't envision myself doing anything else. So I loved knowing, even in high school, when I knew some medical information, I would brag about it and try to actually give medical advice when I was only in high school. So I just loved medicine. and that's all I wanted to do. But then, so when I started my training, hematology and oncology was not in my mind actually. I started my internship in 2009, and I left Syria, and I was, I have eight other siblings, and I'm the youngest. And I used to take care of my parents when I was in medical school. They were starting to get older, and I used to drive them, do everything they need. And then when I left, I felt like there's a gap. At that time, my father had started having some belly pain. And I was like, okay, what could that be? So I started my internship, and only 2 months into my internship, we found out that my father had pancreatic cancer, and it was metastatic pancreatic cancer. So it was around that time when I was doing my oncology rotation. Again, I had not envisioned myself doing oncology. But then I just, with every patient, I saw my father, and I really wanted to transform oncology, help patients who have cancer. Uh, I think my father's story played a big role in me choosing this kind of specialty. So I ended up doing the oncology.
Well, it's a very inspiring story, and I mean, thank you for all you have done. And again, nothing more precious than the family. Now, let's go again about what drew you to SAMS. I mean, you have been done a lot of missions. As I mentioned in your bio, you have been involved in refugee education and oncology and others, and in global oncology. What drew you and inspired you to join Syrian American Medical Society?
So since the war started in 2011, we all as Syrians wanted to do something, right? And you felt like your hands are tied. You really can't do much. You do some donations, but that really doesn't give you the feeling that you're looking for. And it was until after the earthquake when I remember I was like scrolling into my Facebook, and I saw a post from Dr. Basil Atassi. It was after he came back from his medical mission after the earthquake in North Syria, and it was such an inspiring post. It gave me the feeling that I wanted to have, and I was like, yeah, I do want to, I want to do that. And I actually approached Dr. Atassi and told him, I want to go on your next medical mission. I want to be there. And he was like, are you sure? I'm like, yes, I'm sure. And we kept talking every couple of months. He'll be like, are you sure you want to go? And I'm like, yes, yes, I definitely want to go. And then I ended up going last year in September. And I honestly was not a SAMS member until then. I remember I became a SAMS member after I went on the medical mission. And the reason for being involved in SAMS is because it gave me the opportunity to um, do what I'm looking forward to do for the Syrian people. And also, I was very pleasantly surprised with how organized SAMS was when I was on the medical mission. I mean, you feel like you're really investing in a great organization. So that just motivated me to be more involved in SAMS. So both me and my husband became members after I came back last year, and we just, starting becoming more involved.
Okay. Uh, that's very good to hear, but I want to drive more. Personally, myself, I've never been on a mission, so I want to ask you more. What is the most challenges, or I should say, one of the highlights first of your trip and doing that mission? Because all of us, we say we're going to go there. There is maybe where it's endangering your life being. Maybe you are going to be at risk, or maybe it's just everything smooth as you mentioned, and you want to put your effort. So tell us a little bit more of your experience, and would you do it again?
So when I came back last year, I told my husband I'm going back next year, and you're going with me. And this is, it was a decision that had absolutely no, it was a already made and firm decision right then. It's really the feeling, we all talk about helping people feels good, and it truly does. But there's something about helping people who are in desperate need that's exactly the feeling that you get when you go there. It's people are so appreciative, and you feel like you're doing so much for them. It's also not only, we do great things on the mission, especially the surgical specialties. They do very complicated and highly technical surgeries that there's no way for these surgeries to make it to Northwest Syria if it's not for the medical missions. But really, not only that, it's the feeling that you give to the people there that you are not forgotten and that we remember you. We go a little bit out of our way to help you and be here for you. I think that's really the feeling that they wanna have.
Well, thank you so much for you have done and definitely your effort and volunteer work. This is coming out of your time and all the volunteers as well as the people going on missions. This is phenomenal work. Tell us about what is up and coming for you in your career and what do you see yourself going forward from now on?
So when we were on the mission, we launched a very important program, which is lung cancer screening program. It's really it arises from the need that we need to focus on preventative medicine in this area because it saves more lives and it's cheaper. Unfortunately, I saw patients who would sell their properties to get one dose of immunotherapy for metastatic cancer. We're trying to shift that towards screening for lung cancer and doing cheaper treatments that work better. So that's one of the main projects that I'm working on is the lung cancer screening project. We have a huge SAMS team. We have been meeting every month for the last year, to establish this project. So that's going to be an ongoing project. I also here in the US, I work in. I'm also launching a very similar project, which is lung cancer screening in refugees in the Dallas-Fort Worth area. So that's another project that I'm working on with the medical students. And by the way, we have very, very motivated medical students. When I've talked about my global oncology and global health work in several occasions in lectures at UT Southwestern. And every time I get several medical students and trainees who are interested in helping out. So this is a project that I'm working on with the other medical students. So that's kind of that's my passion is actually global oncology and specifically in lung cancer. See if we can transform the treatment for lung cancer from treating more metastatic disease in refugees in Northwest Syria to actually treating more of an early stage disease where the outcome can be much better.
And that final point is about mentorship. You mentioned already and touched on how important it is, and you are fostering the next generation. What are the opportunity for people to join your lab, join your institution, to be part of your research team that can help them get to where you are now?
Yeah, we have a huge room for in our projects in Northwest Syria. Whether it's data collection, designing projects. There's so much that needs to be done. We need to develop a smoking cessation program that's really a must. Hopefully in the next few months. So that's another project that we're working on. I need people to help me in designing, data analysis, writing all of that. And, there are some restrictions from UT Southwestern to only UT Southwestern medical students, but there are so many other projects that doesn't have to be linked to UT Southwestern that I can have other medical students or trainees work with me and it can be very, very high yield and very impactful. So I'm always looking for people to help me and just feel free to contact me if you have interest in working with me on global oncology.
Well, this is a plug for all the people listening to us or watching us. This is a call from Dr. Rashdan. For sure, we'll have your contact information posted on the social media and also in the description of this video when it is posted. Well, Dr. Rashdan, you have it all. You are a clinician, researcher, humanitarian, a mother, a spouse, and you have it all. I mean, you are a full deal. You are the whole deal. Really appreciate all what you have done, and really, it's a privilege to have you on the first episode of the Sam Voices. We thank you for your time. We thank you for commitment, for your patience, for your institution, as well as for the Syrian people and all what you have done out of your own time. We appreciate you, and hopefully we see you in the next mission or again in the next episode in the future.
Thank you so much. It's always my pleasure to be here.